Good morning, warriors. My name's Kerry Duval, the Mental Health Warrior's wife. Today I'm joined by Kerry Bear, the Human GPS. Morning, Kerry.
Good morning.
How are you?
I'm warm, thank you. As you can probably tell by my hair floating around, I've got the fan going.
Yeah, mine's broken, so I'm all right. I'm just gonna melt.
Bless you. Yeah, it's also blowing a bit of dust around at the minute, which is why I keep doing that. So I do apologise.
And we're also joined by Robin Burney. It's first time on Warrior TV. Welcome, Robin.
Thank you. It's really nice to be here.
Tell us a bit about you, because it's your first time on Warrior TV.
A bit about me. Well, obviously I'm here to talk about gambling addiction and gambling, and the company that I am actually working with at the moment, Deal Me Out. I've only actually been working with them for a few months, but the things that I've learned from working with them, it's just insane. But before then, I'm still doing my master's in clinical and health psychology, and before that, I did my undergraduate in psychology with neuropsychology. So I've been involved in psychology for about 5 or 6 years now, just back to my A-levels where I started really developing an interest and volunteering and everything. So there isn't really much else about me that's quite interesting. I really like blueberries. Yeah, blueberries are good.
I don't like blueberries.
Do you not? But not even a blueberry muffin?
No.
Oh, no.
No. Adam does. I don't.
Oh,
that's just me. Well, to settle the nerves a little bit, Robin, we'll do a couple of quick fire questions. What's your favourite colour?
Blue.
Kerry, what's your favourite colour?
Purple.
I like purple.
Yeah.
I think it's a Kerry thing. We all like purple.
I must have missed the memo.
Yeah. Robin, does pineapple belong on pizza?
No. I mean, the thing is, I don't like pineapple in general, but I've had an unfortunate encounter with pineapple on pizza. It's a horrible story that I will not go into because it's not very nice, but no, in short, no, I'm afraid not.
I like pineapple on pizza. I do. What about you, Kerry? What do you think?
I do like it on pizza, actually. But I will say that I actually can't eat cheese. So any pizza that I have is completely devoid of cheese. So I think any kind of topping really is it works for me without the cheese. So.
And Robin, cat or dog?
Can't I just have both? I love both. I love them all, just all of them. Can I have them all?
Yeah. Oh, I'm a cat person. We've got 9.
9 cats.
Yeah, and one of them caught a baby rabbit this morning, so we're making sure it's okay.
Oh, bless
so that's our little thing this morning. Yeah. What about you, Kerry? Cat or dog?
Well, again, I'm like Robin. I can't decide between the two. I love them both. I do have 2 dogs at the moment that kind of keep me on my toes. And with my own experiences of having cats and dogs, dogs are generally more interactive. Whereas I do find that with cats, it's very much on their terms. But I love both, so I can't decide really.
Yeah. The culprit for the baby rabbit has just come through the window.
Oh, bless.
Yeah.
Knew we were talking about them.
She's Adam's, not mine. She's Adam's. Yeah. So obviously today we're talking about gambling and addiction. So obviously, we had Jason Bishop on a week or so ago, and he was talking about alcohol addiction. What do you think about that, Robin?
Well, something I found out a lot is that addiction, when you look at it from sort of a brain perspective, which is where I get really quite excited, they work on very similar mechanisms, and it's sort of the same sort of pathways in the brain and associations. And I must admit, looking at the different addictions, it seems that certain addictions have more of a recognition as an addiction than others do. So, for example, alcohol addiction, like you said, drug addiction, they are becoming quite big things in terms of it's an addiction, it's not just something that can be controlled. It deserves recognition and help, and it seems to be more understood than other addictions, which is where they're sort of coming up now. They're catching up, for example.
Yeah. What about you, Kerry? What do you think?
Yeah, I mean, I've got to kind of agree with what Robin has said, that there are certain ones out there that are not necessarily fully recognised as addictions at the moment. It's an interesting area, and one that I personally would like to learn a whole lot more about, purely because I've not had many dealings within it, other than the fact that what I've discovered is that with the majority of those who have these severe addictions,
Yeah.
it's generally tied, cover up, some form of trauma that they've experienced, perhaps in childhood, or as they're going into adult life at some time in their life. Because let's face it, there's no like minimum. You can't. There's no law that says you've got to be an addict by this particular age or that particular stage. It's something that happens and evolves over time, isn't it?
Yeah. Yeah, so obviously, Robin, before we came on, we were chatting about, obviously, you've just finished your Masters at university. Well done.
Oh, thank you.
Obviously, from a more professional point of view, tell us about addiction.
So from more of like a neurological basis type thing. Well, addiction's really quite interesting, and they've done lots into it, and the basic mechanisms of it. So in our brains, we have something called a reward pathway, and the purpose of this reward pathway is to release dopamine when good things happen to us, like if we get a compliment or something good happens to us. If we're about to walk out and it stops raining, and we get this sort of feeling of, oh, that was quite nice. But also when we do things that are considered in evolution terms to be good for our survival. And these are two really good things to happen, and they release the dopamine when we do these things because it's trying to get us to do them again in the future, hence to maximize survival. And that's all really good. But when we look at things like gambling and drinking alcohol and taking drugs and all of these indulgent behaviors, we find that they release around 10 times the amount of dopamine as more ordinary behaviors do. And if you've just gone out for a jog or something, because that's quite good for fitness, it can make some people feel good, it's good for mental health, and you get a little bit of dopamine release. But then you have quite a few drinks, or you go and place a bet or something, and that releases 10 times the amount. It's fairly obvious which one you're probably more likely to repeat in the future. And over time, this then carries on going, and all this dopamine is constantly in your brain, and the brain isn't meant to function at that higher dopamine level.
Yeah.
And things like memory and judgment and decision making start to get affected. So they found that addiction actually can physically change the structure of someone's brain, which is, again, it reiterates how it's not just something that someone can stop. It is a real thing that is there. It is something they're suffering from.
Yeah, I mean, obviously, I agree with you with the gambling addiction. You go to a betting shop, put a bet on, and you win. You feel good, and you think, I want to do this again. But obviously, it's having that control.
That's the thing. It's really quite easy to lose control. And in fact, they actually they put someone who gambled professionally inside an MRI machine, and they had him run sort of a roulette simulation, and they found that when nothing was happening, there was very little stimulation in the brain, and then when they won, there was a lot of activity. However, they found that when there was a near miss, so say they put their number on 27 and it landed on the number next to it, they got the same activity from these near misses, and this encourages sort of chasing losses because more people lose than they win. So these near misses encourage you to keep going, and that is when it becomes a massive problem.
Yeah. And obviously, again, it's going back to having that control, isn't it?
Yeah,
What about
exactly.
you, Kerry? What do you think?
Yeah, it is. It is definitely something that, once you've got into it, you allow it to take control of your life. For the very reason that it gives you that hit, um, and your body, your mind starts to believe that actually it needs that hit in order to get through each day. So it doesn't matter, as Robin said, it doesn't matter whether it's gambling, alcohol, drug addiction, anything that can be classed as an addiction will give you that feel good factor. And as I say, that the brain starts to think that actually I need this every single day. And I mean, yeah, with alcohol and drugs, even smoking tobacco products, it's kind of slightly different because it's a substance that you're putting into your body. So of course your body then starts to rely on those substances, and so therefore it no longer is just purely a psychological thing. It's actually a physical thing as well. Get the gambling, I get it. It is a psychological thing, and I think it's that belief that the big one's going to come up. It's definitely going to come up for me, even though you might be like tens of thousands of pounds in debt. But it is a coping mechanism, and as I said, the majority of the people that I've spoken to that have an addiction of sorts, it's come about as a way of coping with something usually traumatic that's happened earlier in life, be it childhood, or even during adulthood. So I suppose you could say I find the brain an absolutely fascinating area, and I'm still learning very much on the different sections, the neural pathways, and how it all connects up and works. But yeah, it's an interesting area.
Yeah. Sharon Chamello, our emoji warrior, has commented, vaping is huge here at the minute. She's in Australia. Teens are hooked. They ought to be illegal. Lolly flavours and shiny tubes. But obviously, I can see the novelty of vaping. So what, especially with teenagers. I mean, I've got a niece that's a teenager. She's into vaping at the minute. She's always got the latest one. The same with my sister. She's always got the latest one. It can be like a novelty and a trend kind of thing, can't it?
Yeah, that's an interesting thing actually, because I think looking back at when it first came out, I mean, I don't know about it very much, but it seemed to be a sort of an alternative to smoking, because you see on all the cigarette packets and everything, all the warnings, everybody knows the health warnings associated with smoking. And when vaping came in, it sort of appeared as more of a safer or a cleaner version, equivalent. But the thing is, as they've gone on, there are then other studies and other research which have found different issues that can come from vaping that are different to smoking, but can still be just as hazardous.
Yeah.
So it is quite worrying, and the increase in how many. But yeah, making them all these different flavors, because that might be one of the reasons that some people don't smoke, because of perhaps they don't like the smell, they don't like the taste or anything like that. Whereas these appealing flavors, especially the really high sugar ones, they instantly open up to all the teenagers, and they get the same sensation of smoking with different risks, but it tastes better, it smells better.
Yeah. What do you think of vaping, Kerry?
Yeah, I mean, it's. I have to agree with what Robin's just said. But I think as far as I think a lot of it, certainly with smoking tobacco products and with vaping, I think a lot of that is purely down to peer pressure. And like you said, there's a lot of younger people vaping these days. In fact, I see more teenagers vaping these days than I do smoking cigarettes or any tobacco products. So, but then you see vaping has been backed and supported by the medical profession.
Yeah.
as the safe alternative to smoking tobacco products. Now, yes, there are certain things that are coming about now that are being reported, that are arising as a result of vaping as opposed to smoking tobacco-based products. But equally, I think we've got to remember that even cigarettes were once, decades ago, advertised by doctors and surgeons, as the ideal way to wind down after a busy day at the surgery. So, I can kind of see it going full circle, really. And I guess, anything that we're putting into our lungs, unless it's really, really being prescribed by a medical professional for something such as asthma or a breathing related condition,
Yeah.
then I think we've just got to be very aware and very wary of what we're doing.
Yeah. So obviously, on the subject of vaping, there's obviously CBD. Now, obviously, CBD can go into a vape and it has certain health benefits. But then obviously you can get like little liquid to go with it to change the flavour of the CBD. And you can get 0% nicotine. So would you say that that's going to help people, Robin?
The thing is with these, I don't feel like there's ever going to be a yes no answer to that. I feel like it'll be a maybe, or it depends. And you could break it down to sort of why do people smoke. I think I agree with what Kerry said, that a lot of it can start off with peer pressure and then it can become a coping mechanism, a way to wind down, and then from that it can become a habit, it can become an obsession, it can become an addiction. And the thing is, once it starts becoming a dependency, it almost can stop becoming a conscious choice, and it just has to happen. And once that happens, like if anybody, for those who advertise it, that's their job done. They don't need to advertise to those people. They then move on to the next ones. I haven't really heard much about this 0% nicotine. If it's designed to help people maybe wean themselves off, that'd be brilliant, or to get the same sensation but without the dangerous chemicals involved. Again, if that is a way to help people reduce the harmful carcinogens that might be in the cigarettes, that might be a good thing. And again, it's all these new things that are coming out, and it's just being wary that even new things that come out to help, they might have their own effects. So if you're able to go without all of them, that would be fantastic, but obviously not everybody's in that situation to do that. So I think it's a good thing if they're able to do these, but again, just be wary.
Yeah, I think obviously vaping, obviously it's been advertised as the alternative to smoking, and they have different levels of, in the liquids, you have like different levels of nicotine, from high up quantities right down to 2% and 0%. I mean, personally, I've seen them in shops, 2%, 0%. I've seen them myself when I've done the CBD. And obviously it's there as an option for people. So, right, moving away from vaping, moving on to, Adam actually put a question about gaming addictions. Do you think it's a personal choice or a serious addiction to have a gaming addiction?
Well, even going back to when I nattered on about the brain and got really excited, again, it can generate the same feelings, and I think it can be a matter of control. So for many people who game, it is a conscious choice to game, and they're in complete control of it. And they might spend a few days playing a game if it's a new game, it's all come out, and if all their friends have got it. If they do spend a few days, it doesn't have to be a problem, it doesn't have to be an issue, it doesn't have to be an addiction. However, for some people it might be, when it stops becoming a conscious choice, when it becomes I have to do this, I need to do this.
Yeah.
That can be when it becomes dangerous, and it's starting to become recognised as an addiction, because I know that the NHS, and I think her name is Henrietta Bowden-Jones, and she started, or helped start, the first gambling addiction clinic as part of the NHS. She has now worked towards commissioning a gaming addiction clinic aimed at ages 13 to 21 initially. I'd have to double check that, but it's starting to become recognised as it can be something that children and young people, or anybody really, can suffer from, and that they can be helped and supported through.
Yeah. So just tell us a little bit like what support is out there for somebody who feels like they've got an addiction.
It would depend which addiction, because you've obviously got loads of different resources for each one. For example, for gambling specifically, you've got GamCare, which is the National Gambling Helpline, and they have loads of supportive elements and even things like little tools that they can set. So one of them, you've got GamStop, which can stop a gambling advertisement from reaching you, and that can be a big thing for people who are recovering from a gambling addiction or still suffering, seeing all the advertisement that's around, and being able to just stop that from their social media and their phones can be a big help. And other things like Gamban, which then stops people being able to access the gambling website. So if they wanted to type in William Hill, it would stop them immediately. So it can provide support in loads of different ways. And again, they'll be the same for all other addictions in more appropriate ways for each addiction, if that makes sense.
Yeah.
So there is lots out there. It's just, sometimes it's not that well known. Sometimes it's not as easy to find, but even getting in contact with someone. So at Deal Me Out, we offer people to get in contact with us if they are not sure who else to contact, and we can sort of act as a signposting company in the middle to guide them to what is out there, because we do know. So, and there'll be others like that for all sorts of addictions.
Yeah. So what do you think drives people into addiction? Because obviously we already talked about, we can control the situation ourselves, but then obviously it's that next step into addiction. What do you think causes people to take that next step?
It can be quite a few different things. Like Carrie said, quite a lot, that sometimes trauma can be a big part of it, and it can be looking for a specific coping mechanism, and you come across something that makes you feel really good and think, oh, I can resonate in this, I can lean on this, this makes me feel good, I can trust in this. For others, it might start off as in control, and then it might just slip into losing that control without them even noticing, because there is a fine line between being able to control it and not being able to control it. So I think it's a very unique and independent thing as to why someone can slip from being in control to not being in control.
Yeah. What about you, Kerry? What do you have yours saying on this?
Well, I think Robin's mentioned two very, very key words through so far. The first one is choice. We all have the choice to do or not do something. So if if we decide to do something, then we are responsible, and it's not. Then you cannot place responsibility anywhere else. We are completely responsible for everything that we as individuals do. The other one, as I said, is control. And whilst yes, Robin is right, there is that fine line, particularly with people who do have an addiction. At the same time, we are fully capable of being in control. It's very much a case of retraining the brain, because we've learned to do something, so we can unlearn it, basically, and it's the same with any kind of behaviour. If we're doing something that doesn't serve us, that's of no use to us and potentially dangerous to us, then we can unlearn how to do that. We can learn new behaviours that are of much more use to us and more healthy and more supportive.
Yeah. Obviously, there's not just the big ones, is there? Obviously, drugs, alcohol, gambling. There's also the other addictions as well, such as obviously gaming addiction, vaping addiction. But then what about the little ones like chocolate addiction, shopping addiction? Personally, I think I'm addicted to chocolate and shopping. That's just me personally. When it comes to shopping, I'm like, I'm out there. I'm gone. You know, how do we raise more awareness about the little types of addictions that are out there? Because obviously there's got to be lots of them.
Yeah, you're right there. There are quite a few, and you're right in that they aren't really well known. And I think for that, it sort of depends on what it is. So like you said about chocolate and shopping, and because obviously having an addiction to food, that is an addiction. But in our society, if you are having a bad day and you have 3 tubs of ice cream, or you go out and buy a massive bar of chocolate, it's almost accepted in society. It's like, yeah, if you have a bad day, you can have a binge on food. However, that doesn't account for the people who do have an addiction to food. So I think because it is so socially accepted, it's often forgotten that it can become a problem. Whereas with things like alcohol and drugs, it's alcohol possibly a bit more like food because it is promoted to have a glass of wine to relax and everything. But if you think about things like taking drugs, it's not common in society for drugs to be recommended to just have it to wind down. It's not within sort of the social protocol type thing.
Yes.
And because of that, drug addiction is very well recognized. So perhaps it might be more to do with that. But then you've got other addictions. So there's a pornography addiction. You can have addiction to sexual intercourse. And those are really sort of not well known and not well understood. Again, because for some people, there might be some sort of stigma that those who are quite obsessed or addicted to those things, that it's their own conscious choice, that it's something that it's a fetish, it's classed as a fetish, and that becomes, again, almost accepted, but not accepted as a problem and not understood. If it is a problem, it's not always a problem, but for some it can be. And because of how it is recognized in society, it might be very difficult to change how society represents it.
Can I ask a question there? On the topic of sex addiction, again, it's not something I'm very familiar with. It's not an area that I'm familiar with, either personally or professionally. Could it be possibly that the reason why it's not a widely known addiction, could it be because, when, for example, when couples go for relationship therapy, counselling, coaching, whatever you want to call it, obviously there's an element of the physical side of the relationship there, and in many cases you'll find that one partner has got a pretty high sex drive and the other one has got a pretty low one, so there's going to be a bit of conflict there anyway. So is it that many people would actually just look at it as, well, they've got an extremely high sex drive and there's nothing wrong with that?
Yeah, to be honest, I agree with you there. That's the thing. It can be given another name. So it's sort of taken away from being a possible addiction, something someone might be struggling with, and just sort of going, oh, that's just how they are. That's that. So it is, I think a lot of sort of our understanding of different addictions comes down to its depiction within social etiquette and how it is seen in society, because for certain things, they are represented quite highly and quite positively in society. So someone having a problem where it can become really debilitating on their lives, they are almost battling against this positive view of it in society, which can make it really difficult to be heard that this isn't positive for me. This is quite negative for me.
Yeah.
And obviously addictions, going back to obviously a chocolate addiction, or a food addiction, we'll just call it food addiction. A food addiction obviously can very quickly turn into maybe an eating disorder. There's binge eating. We've just recently been doing about that in the courses that we've been doing, which Adam has passed, by the way. Congratulations, Adam, by the way. He's passed his course this morning. I'm still waiting for my final mark. Fingers crossed it's not too far away. No. But yeah, I think I've lost track now. Eating disorders, binge eating, obviously that all ties back to mental health. Obviously, from a mental health perspective, we tell ourselves we need that little bit of food, we need that certain thing to get through the day. So how can families and friends help a person that they think has an addiction? We'll start with Kerry.
Well, yeah, that's not the easiest thing, to be honest, because anybody with an addiction will not basically seek help, will not be receptive to anybody trying to help them until they themselves recognize that they have an addiction and it's damaging to them. So I mean, I can't sort of say that, you know, we could do this, you could do that, you could do something else, purely because it depends on the individual circumstances and the individuals concerned and the kind of relationship that they have with those in their immediate circle, you know.
Yeah.
And as I said, the most important thing is that the person with the addiction has got to accept and acknowledge that they have an addiction and actually want to do something about it.
Yeah. What about you, Robin?
Yeah, no, I am based on what you were saying, it's a very difficult situation because there are many circumstances where family and friends have recognized that there is something going on, but have then approached the person and it has not been well received. And a lot of it is sort of around the person who does have the addiction first recognizing that there is something wrong, there is a problem, there is an addiction. And then from there, once they have found the confidence to even confide in one person, the people who are around them, it reminds me of when I was in my counselling module as part of my degree, and they taught us something called active listening. And it just involved listening to everything they said, and instead of positing suggestions and advice and throwing everything back at them and going, let's do this, we can do this, we can do this. It's giving them the space to say what they need to say and have the time, even when they take a break, to just sort of resonate with what they've just said and sort of turn back what they've said and go, so you've said that this is what's happening, this is how you're feeling. So what would you like to do? What do you want to do? What's the next step? And how can I help? And just sort of let them sort of explain what they need. Because for some people it might be that they need, if it was me, I'd need lots of cuddles, I really would. But for some people they need a bit of space, but just knowing that the person in the corner of the room who has given them that space is still there, and that they do have that support, and it's all in their own time, there's no expectation or anything. So it is difficult for the other people around them, but patience and understanding and properly listening, just to give them that space and that chance to talk.
Yeah, obviously Sharon Chimello's mentioned rehab is always an option, and it can be at home as well. Obviously, when it is at home, you need to non-judgmental people around you. So obviously, talk us through about the different rehab options, Robin. I'm picking on you today because you've got the qualification in it.
No, it's fine. Don't worry. I like all the questions that make me think.
Sorry, can I just say that yes, there are lots of rehab options out there for people, but again, it all comes down to that individual actually acknowledging, accepting, and wanting to make those positive changes. But sorry, I interrupted.
No, it's a good point what you said, because from what you said there, I can build on that, and it is sort of, it does have to be their choice. It has to be something they want to do and engage with. And in terms of the rehab options these days, there are so many different types, and they come in different forms. They can be situations where you go away somewhere and you will stay there for a couple of months and for as long as you need, and engage with the support they have there, the facilities they have there. For some people it can be engaging in sort of rehab scenario at home. surrounded by people to help them. For some, it could be sort of more of a slow process. So maybe going to support groups every week or twice a week. It's a very independent and unique thing, recovery. And there is no sort of one size fits all. There is no, you have to do this first, and then this, and then that, and then you'll be fine. It is a very unique thing, and it has to be something that works for you, because people work in so many different ways. And these days, like, these facilities that are available are starting to recognize this and offer these different sort of pathways and different options. So there is more out there today than there was a few decades ago, even a decade ago. So there's a lot out there, and these days a lot of them actually do listen to what you think will help and go through that with them.
Yeah, so obviously, again, it all goes back to the choices. Obviously, Adam's put that in the comments. So obviously, we choose to have the addiction, we choose to let it get to the addiction point, and then obviously we can choose how we go about to get help ourselves. So.
Yeah, I mean, it's encouraging, really encouraging to know that these places, the wonderful people that work in these rehab places, are recognizing that each person is very different, and so each person is going to respond differently to different things. So it really can't be a one size fits all treatment, and it's very much the same with coaching. You know, I mean, I was chatting to a potential client the other day, and I was explaining that whilst I offer these specific packages, each package is actually tailored to meet needs of the individual. So just because this one's called this and that one's called that, doesn't mean that, you know, there's a set procedure, that there's a set process to go through, because everybody's different. We all experience different things differently because of our own experiences and because of our own values and our own beliefs.
Yeah, definitely. I mean, obviously, you go through trauma. Trauma can push you towards it, can push you towards a certain addiction.
Yeah, that's it. And, you know, what's traumatic to one person may not be traumatic for another.
Yeah, because obviously, again, that's going back to maybe the choice of how you're going to deal with something, which is resilience, which is, again, that's something else we've covered in the courses. But yeah, obviously, people's resilience levels are all different depending on what sort of childhood we've had. Somebody with good resilience will have had brilliant childhood. You know, the parents would have been really supportive and they would have had a stable life. But on the opposite side, somebody who has a bad childhood, who didn't have a stable life, who maybe had separated parents. So how's that connected to addictions, Robin?
It's a very complex thing, sort of childhood experiences, and it all sort of goes in how we react to things individually, because we all react to things differently. Like you said, some people can experience one thing and react completely differently to the person who's just experienced it as well.
Yeah.
And again, it's there's a lot of this going on in sort of lots of psychological theories. It's this it's exploring these as possible explanations for what's going on, and again, it's allowing the exploration of these things and really exploring how one actually feels about it, because for some people they might go through things, not realize how traumatic they were until 10 years down the line. But obviously 10 years is a long time, and they might have even forgotten lots of the details. But some therapies these days, they explore this, and then they actually uncover how they really feel and how it actually affected them. And even that little bit of clarity right there can sometimes help. But there is sort of a general trend that trauma is quite heavily associated with developing addictions. That it's the same with things like developing issues with mental health and suffering from various other things, and just how they experience things, how they experience life. Even previous experiences can dictate how you experience life in the future.
Yeah,
So
I'm going to stop you there, Robin, because trauma is actually on next week's
Oh,
Coffee
I won't say
morning.
too much then.
Yeah. So what we'll do is I'll invite you back to come on and talk to us about a bit more about trauma.
Oh,
If you would
awesome.
like to. Same time next Monday.
Yeah, that would be brilliant.
Yeah, again, it'll be with me and Kerry, and I think Karen Unruh is going to be joining us as well. Adam, have I got that right? Karen Unruh is joining us next week. I know you're on the comments. He's useless.
Oh,
Yeah. Well, thank you very much for both of you for joining us.
Pleasure.
Tomorrow, we've got a new segment coming up on Warrior TV. It's called Mental Health Happy Hour with J.R. Reid and our brand new warrior, Jason Cotton. He is the bipolar warrior. I'm not going to say too much. Tune in tomorrow for a Mental Health Happy Hour. Thanks again. See you later.
Thank you.